sinus allergies, and it seems like that's something we would talk about in the spring. You always hear about sinus problems during the spring, but nowadays it seems like people have them year-round and during the fall.
Well, there's two times, it's fall and spring, because anytime you have cooler weather, rains coming in, the cedar wind from up north, all these things increase the pollen count in the air. And once the pollen count in the air goes up, obviously the likelihood of people getting exposed to certain factors in the air that they're allergic to also goes up. And once you have this allergic response from the body, what happens is things swell. If your nasal passages swell and if your sinus isn't able to drain appropriately, that's when things get clogged up, and you have an increased risk of getting infections and inflammation.
And you seem to notice that everyone at the same time gets the same kind of symptoms, and everybody's rushing to the allergy pill aisle.
Right.
Is that one way to head off problems that could get worse?
It certainly is. If you're allergic to something and you know what you're allergic to and you're exposed to it, then you should definitely go get something that will decrease your symptoms, because that will allow your sinuses and your nose to drain appropriately. Whenever things get swollen and stopped up, then it's significantly increased risk of getting infections and just being uncomfortable.
And what should you do when you go to your doctor? What type of treatment are you looking for, and at what time do you do that? Some people immediately when they get sick, they go right to a doctor.
Right.
Maybe they could take an over-the-counter medicine and save some money, but how do you know when you should go?
Well, specifically if you start having pain. If you lean forward and you start having sharp pain right here by your cheeks or up here right in the middle of your forehead, behind your eyes, that's a reason to go. If you start having fevers or chills, if your symptoms are persistent, they're lasting despite taking the appropriate medications over the counter, those would all be reasons to go. And certainly if this is the first time you're getting them, you need to go see somebody who can teach you what to do. Involve nasal flushing. You can go to the store, buy some nasal saline spray, wash your nose out so that it can get out some of the debris and some of the other matter that could be clogging the outflow so the sinuses can drain, and then taking the decongestants and the allergy medications that you spoke about earlier that will also allow the swelling to come down and allow the normal natural drainage.
And I guess in some extreme cases someone might need to have surgery to clear this stuff up. A pretty simple, easy thing, or not?
Not necessarily. If something like this is persistent, then you can have a persistent swelling where your sinuses can't drain at all. It can also be exacerbated by something called a deviated septum. So these things would need to be evaluated by imaging studies, and then either your family doctor or your allergist can then send you to a surgeon who may need to do something else to further encourage the drainage of those sinuses.
Well, hopefully we can just stick to over-the-counter medicine.
That's right.
That'd be a good way to save a lot of money and maybe get those sinuses under control. Thank you again, Dr. VJ, for joining us. And if anyone ever has a medical question they need answered by the doctor, email